Hello, I'd like to welcome you to A Healthier You. I'm Larry Macon Jr., pastor at Mount Zion Oakwood Village, and I'm also the co-host on the show It's About You on WKYC, where I do a segment called Everyday Champions, where I recognize people in the community that are doing great things. However, this segment is about you. Yes, it's about your health. You know, as a leader in the community, I felt compelled to make sure that we get you the latest information in all areas of health. And that's why I'm pleased to be partnering with university hospitals to spread the word in our community that you can live a healthier life. Today, I'll be speaking with Dr. John Jasper of University Hospitals. How are you, Dr. Jasper?
Hey, Reverend, how are you?
I'm
Thank
doing
you so
well.
much for inviting me to your show.
It's so good to have you on. So what are we going to be talking about today?
Well, we'll be talking about hernias.
Okay.
As you mentioned, I'm a physician with University Hospitals. I happen to be a general surgeon.
Okay.
And as a general surgeon, you're often asked to help patients who have symptoms related to hernias. So that's our topic of today.
Gotcha. So what is a hernia, Dr. Jasper? What could that be characterized as?
Okay, so a hernia is a concept that some people have trouble wrapping their heads around. But in general, let me back off by stating where hernias happen. Typically in your abdomen and what most people would call their stomach area. Mm-hmm. And a hernia is a bulge or protrusion of an organ through a hole in the abdominal wall. Mm-hmm. And I wish we had a chart or a graphic to show you, but the way your body is made, particularly your abdominal wall, is that on the outside, there's a coating of skin. And then beneath that, in terms of layers from the outside in, is a layer of fatty tissue. It's like your insulating layer. Okay. And then all the way deep, there's this membrane called the fascia. And that's very strong, but very pliable. It's like leather. I use the analogy that it's like leather. And if you get a hole or defect in that membrane, things from the inside tend to protrude out through the hole. Wow. So for the manifestation for the patient is a lump or bulge, and they can have symptoms or not, but most commonly it shows up as a bulge. So in reality, that's a breach in the abdominal wall, in the integrity of the abdominal wall.
Wow, how common is that? I mean, how many people get that, or how
that's
common?
That's a good question, Pastor Mick. It's very common. I would estimate that about 5 million Americans have a hernia.
Wow.
That may or may not need to be repaired. Mm-hmm. And in terms of health cost dollars, about 2.5 to $3 billion are spent on problems related to hernias and surgeries and that sort of thing.
Wow. What are some of the symptoms of a hernia? What does a person feel to know they have it, other than maybe to see the bulge?
Well, some hernias can be asymptomatic or not problematic at all. But typically the most common symptom of a hernia is the bulge. Now that bulge can be at various places in the abdominal wall. Mm-hmm. Most commonly we see hernias in the groin regions, mm-hmm. around the belly button, mm-hmm. up above the belly button, or sites at previous surgeries, because if you've had previous surgery, oftentimes that creates an area of weakness in the abdominal wall, which increases the chance of the development of a hernia. Now, like I mentioned, some hernias can be asymptomatic, meaning, a person may notice a bulge for many years and not have any problems whatsoever associated with that hernia. Mm-hmm. But then oftentimes if there are symptoms, those symptoms are made worse with exertion, such as exercise, sometimes with coughing, sneezing, laughing, or anything that increases the abdominal pressure from the inside to cause the protrusion to get larger.
Wow. Is there a certain time when you should see a doctor or a nurse?
if if well, if a person discovers they have a hernia by a bulge, whether it's asymptomatic or not, it might not be a bad idea to have a surgeon to take a look.
Hmm.
And in smaller hernias, sometimes you can watch those,
Hmm.
especially like in the groin. The doctor literature used to say that anybody who's diagnosed with a hernia should probably have it repaired. But we've learned that that's not necessarily the case, because those hernias can remain asymptomatic for quite some time and not necessarily have to be repaired. But it's probably a good practice just to have a doctor look at it, to
Hmm.
make note of it, and perhaps bring the patient back a little bit later down the line to have it rechecked.
Hmm.
Now, if the hernia is becoming symptomatic in terms of it getting larger or more symptomatic, meaning when you exercise or lift something heavy, you get more pain, then that definitely should be looked at. The concern is that the organ that's protruding through the hernia has a potential to get stuck in that hernia.
Oh, wow.
Most people who live with a hernia, like for instance, I worked at the VA. A lot of the patients at the VA had hernias. A lot of old vets had a hernia that they've had for many years, and they'd note a bulge in their groin, and they can often push it back in. They'll tell you that they can lay back, they can lay down and push it back inside. That's called reducing the hernia,
Hmm.
and for years that works out well for them. But there, you can imagine the occasion where one day they're lifting a heavy sack of yard mulch or something, and that hernia goes through that hole and gets trapped, and the person can't push it back in. Then that becomes an emergency. That's
Wow.
rare, but it does happen.
Wow.
And when I say the organ that protrudes through, usually it's some fatty tissue that's in the inside of the abdomen that goes through that hole. But sometimes it can be a loop of intestine, either the small or large intestine that can get trapped in there. And like I say, at times that becomes an emergency where you have to take that patient to surgery urgently to not only reduce the hernia and fix it, but evaluate the organ that was trapped in there, like the intestine, to see if it's still viable, still living. And rarely that may have to be resected or spliced out, the bad part.
Wow. Wow, that's amazing. So how do you treat hernias?
Okay, hernias typically are treated with surgery. That's where I come in as a general surgeon. Part of what I do is to fix a lot of hernias. And as I mentioned, for small hernias that are not terribly symptomatic, we can establish um, practice of watchful waiting.
Hmm.
I'll have the patient come back 3 or 4 months or sooner if they start to have symptoms.
Hmm.
But for larger hernias that are more symptomatic, uh, typically require surgery, and the type of surgery depends on where the hernia is.
Hmm.
Um, Nowadays, more and more, we're doing surgeries laparoscopic, with the small incision, minimally invasive.
Wow.
So hernias in the groin and a lot of hernias in the mid portion of the abdomen around the belly button, we do it laparoscopically with small incisions. Laparoscopically implies that the incisions are small and you use a camera to perform the operation. The camera is taking a look at the inside of the abdomen, and then um, and those surgeries are typically performed on an outpatient basis. For
Gotcha.
instance, groin hernia repair, it's called an inguinal hernia repair, is done with 3 incisions. It's performed under general anesthesia, typically an outpatient procedure where the patient goes home the same day, with restrictions to avoid lifting for a couple of weeks and probably be off of work for about a week.
Gotcha.
We typically fix those hernias with mesh. Mesh gets a bad rap because if, every morning I have to wake up and hear all the lawyers talking about, have you been involved with the mesh? But mesh is needed in these repairs to keep them from coming back, to lower the risk for them to recur. And the mesh that we use now is very good. It's not been recalled, and definitely needed to repair these hernias. Well, we found that older techniques to repair without the mesh have very high rates of recurrence, where the hernia would come back to the tune of about 25% in 2 years or so.
Wow.
Now, larger hernias may require a bigger incision. That's an open procedure. That's how we fixed hernias, and in general did a lot of surgeries maybe 20 years ago, with a bigger incision right down the middle. And so typically an open approach would be reserved for a larger hernia that's very complex. And even those can ultimately be done laparoscopically. And then also I'm doing at university hospitals, we have a robot, both at our at many sites, but I typically fix inguinal or groin hernias with the robot over at Hernia.
Gotcha. Is it more common in males or females, or anybody can get this?
Well, anybody can get them, but in general, the groin hernias are more common in men.
Gotcha.
But the women can get them too.
Gotcha.
And again, it presents with a bulge like that.
Sounds good. Well, listen, Dr. Jasper, I appreciate you for expanding our knowledge and sharing with us all the university hospitals is doing to build a healthier you. And so that's our segment for this week. Again, to all of our viewers, you can get this segment on LarryMaconJr.com or go to my Facebook and Instagram, and I will post these segments and make sure that you stay connected with us. And if you need to get checked out, make sure that you reach out to university hospitals. And I know Dr. Jasper, he'll be ready to help you out during this time. Thanks again, Dr. Jasper, for being on the segment.
Thank you, Pastor Mason. Thank you very much. Bye-bye.
Bye-bye.